Welcome to another connection here on TKO8 Television. Dennis King and my co-host Tabitha Odegaard unfortunately couldn't be here today. She has some family issues over in Mountain Home. We hope everything goes well with her father who had open heart surgery over there, but she'll be back with us next week. But we do have a lot of things going on this week, as always. Of course, on Connection, we have different organizations come in each week to talk about what's important to you, what's going on around the broadcast area here. It's your town, it's your community. Stay with us. We'll be back in a moment. We've got two individuals from North Arkansas Regional Medical Center to talk about an important survey coming.
Healthgrades, the leading independent healthcare ratings organization in the nation since 1998, has named North Arkansas Regional Medical Center as a recipient of the Healthgrades Joint Replacement Excellence Award for 2012. NARMC is ranked among the top 10% of hospitals in the nation for joint replacement, for total knee replacement, for total hip replacement, and for hip fracture treatment. The best in care is right here at home, NARMC.
When I went to Dental Creations on the square, I had been to 2 or 3 different places, and I could tell right away that was the place I wanted to be. Being a performer in Branson, I was desperately needing something done to my teeth, but I didn't have no room for finances, and she showed me this package plan, and now I'm making monthly payments on my new dentures, and very affordable. If anyone is looking for dentures, I recommend Dental Creations down on the square, because that's the place to go.
Back on Connection here on TKO8 Television, and our guest in the studio this morning is Vincent Least and Marcia Carter from North Arkansas Regional Medical Center. Thank you both for being back in. Vince, this is the second time you've been in the studio. We appreciate it. I know you've got a busy schedule, but something important to talk about here today. It's something a little new for North Arkansas Regional Medical Center.
We do.
And so I'm going to let you talk about the Community Health Needs Assessment Survey.
Well, first of all, thank you for having us.
You're welcome. This
is really important to us to be able to come down and talk to the community through your organization, so we appreciate it. Community Health Needs Assessment. Now, what we're trying to do at the hospital is through a document that is either filled out by a pen and paper, or on the internet, which we have a website that we've got set up to do that, is an effort on the hospital's part to look at the overall health needs of a community, look at how folks access health care, to try to understand clearly what services we should be developing to serve our community, what services we should enhance, and understand essentially what is the disease state of our community. In other words, if people have if there's a pattern of certain things in our community, then it's the obligation of the hospital as a community to serve the community based on our not-for-profit status, to provide resources for folks in our community to access either education or certain levels of health care or testing, so they can improve their overall health. As we reach out to individuals, we reach out to the community as well to try to increase the awareness of what people can do to manage something that they already have, or to prevent them acquiring some type of disease like diabetes, or how they manage congestive heart failure, how they manage medications, that sort of thing. So the tool is simply something that we're asking individuals to provide us information. The tool is completely confidential. It is being, actually, the information is being collected by an accounting firm, BKD, as an accounting firm that is a very prominent organization, and we use them in a number of ways. And these surveys are being sent directly to BKD Accounting, and they are going to tabulate this information and provide us a report. A couple of things that we must do. We are required, based on our tax-exempt status, that we do a community needs assessment, and that we develop a strategic plan around that community needs assessment. And as you know, there are a number of organizations in our community that do a lot of work around developing a healthy city. We have our NAFI, in particular reaches out to adults and adolescents and pre-adolescents in the schools, educating them. We have our Healthy Communities Network here in town, Healthy Harrison, that has done a survey. Also, the state reaches out to us and does surveys about what services we actually offer in our community and what services we need to. So that's kind of a quick summary of what a community health needs assessment is about.
What's the estimated length of time, Vince, to do all this, or how long are you going to do the survey?
Well, we're going to try to get this survey tabulated and done, but we have to have a strategic plan developed around this survey by April 1 of 2013.
Okay.
Now, the hospital's process of developing a strategic plan, we last year, and in every years going forward, we pulled our medical executive committee, which is a group of our doctors that lead the medical staff, our board of trustees, and any medical staff member who wished to attend to a retreat. So we sat down and talked about what our presumption was of the needs of the community and the needs of the facility. And around that we developed our operational strategic plan. What we will do with this information is fold this into that strategic plan so that the operational efforts of our hospital will be based around what we perceive to be the community's needs based on their input.
You know, I was thinking of something that group of individuals we were discussing one day at coffee or at the golf course or something. We were talking about needs, and a couple of people said, and I'll throw this out, dermatologist happened to come up. You know, they said, you know, boy, I wish we had a dermatologist here. You know, and everybody realizes that we probably can't have everything. We're a community hospital. I mean, we can't do everything, but there is certain needs of, let's say a dermatologist might be a good example, because a lot of people need dermatologists for certain reasons, and they're having to go out of town for that need. On the other hand, we also need our local physicians to support the specialists we have here. And it comes up a lot out there, and I'll just throw it out there. It does. I mean, a lot of people say, well, we've got some specialists here, but we need our general physicians to believe in those specialists and not tell somebody, well, you need to go to Fayetteville or Little Rock or Springfield, because we do have some great, your health grades proved that, and just recently when you were honored with that, which is a tremendous honor for a hospital our size, I thought.
Absolutely.
And we just received another honor, a 5-star rating in respiratory failure treatment. So that's been something we'll roll out sometime soon. But to respond to your comments, my efforts since I've been here is to clearly understand the infrastructure of the hospital, work with our physicians to develop the infrastructure necessary to care for the community. We focused on primary medicine. We focused on general surgery. We focused on orthopedics. We've focused on emergency medicine, and we've also focused on having a hospitalist program. We have some wonderful physicians in town that provide urology services. We have a wonderful physician in town that provides ENT services. So we're very, very lucky to have those folks. We have a rheumatologist here. We have a medical oncologist. You know, to have a medical oncologist and a rheumatologist in a community the size of Harrison is just a gift, because our community needs those services. Now, as we continue to try to develop the infrastructure by recruiting. We just recruited a general surgeon. A new Dr. Andy Coble is in town now, and he's working just as hard as he can to keep up. So we're glad to have him. The higher level services, we are working very hard to provide day clinics for those folks. We do have a pulmonologist that does a day clinic at the hospital. We've reached out to others. The shortage of those folks and their ability to come to Harrison is tough for us to manage right now. But our reimbursement system, specifically the Medicaid Payment Improvement Initiative in Arkansas, the application for the Medicare to be included in the Payment Improvement Initiative, the efforts of our insurance providers to place incentives on the doctors and the hospitals to work together. We'll draw the doctors and the hospitals together and work more closely in the future. In the past, the structure has been the doctors do what they need to do and the hospital does what they need to do, and we try to coordinate our efforts. But in the future, very near future, we're going to be reaching out to our physicians and they to us, and learning ways that we can develop services so that we all survive.
I think this is a very good step forward to see what the community, you know, people, we'll call it coffee shop talk.
Sure.
There's always a lot of coffee shop talk out there. But if you don't give individuals, it's like going out to vote. If you're going to give people the opportunity to go in and be a part of this survey, then they should take the incentive to do that. Absolutely. Because it is their hospital. This is our hospital in this community, and so hopefully you'll get a good turnout of participants in this, so that you can get a good read. Of course, the more the better. Exactly. To get the read you're looking for.
And it's completely anonymous. There's no effort on anybody's part, and even the tool is set up in a fashion where we have no access to personal information. But it's something that we need to know, so that we can work with the Hometown Health folks, the NAEFI folks, and try to develop services that we need here. And specifically, through those services, before we did this community survey, there's a need for behavioral health in our community. There are not too many providers of behavioral health. As a matter of fact, I think there's only one right now. So we're working very hard, and I can talk about that a little later if we have time.
Sure.
But it's very important for us to understand what the needs are, so that we're not doing something that really is not of value to the people that we serve.
Well, we've got a few minutes. Why don't you talk about the behavior?
Well, one of the most important things for a community hospital is its mission is to serve the people that in the community where it lives. So what we have done by using some information provided to us by the state, and understanding clearly that there are a fair amount of folks who are in need of behavioral health services. Right now, accessing behavioral health services, either voluntary or involuntary, is out of our market. We have to send folks a long distance to get that care. And we're right in the middle of a process. We've submitted plans to the State Department of Health to renovate a piece of the hospital so that we can add a fair amount of beds, around 28, to serve adult behavioral health needs and what we call a distinct part unit, a geriatric behavioral health.
Okay.
And I think there's a huge need in this community. And we're going to try to develop that service at the hospital in some beds that we have available and space that we can renovate. And that is going to be, I think, well received. Most of the physicians in town that I speak to clearly understand that they'd love to have something close by so that we can care for those patients.
Fantastic.
And I think that's going to be a marvelous addition. And we have addressed a little bit of that in this survey, too, just to absolutely make sure.
I got to get Marcia involved. All right. A little bit. Marcia, we've got a couple minutes. Even though the show will show after this weekend for a couple of days, you got your big health fair coming up.
We do have the big health fair, and we're very excited about that. We could not make that possible for the community without the student nurse volunteers. Yes. And our auxiliary volunteers as well. And we just appreciate the opportunity to provide those services for the community. And we do it every year, so we'll do it again in October. And the prostate cancer screening as well.
Yep,
we're going to do that on the 18th and a week from today.
Those are great programs for the community, to like the prostate screening and all your screenings. It's no charge to the public, and preventative health, as we all know, is very important in early stages of catching prostate cancer, whatever. So
that's true.
NARMC again doing a great job of supporting the community.
Thank you.
Again, we want to mention events that the Community Health Needs Assessment Survey. I guess you can go online. Is that correct?
That's correct.
www.narmc.questionpro.com. Did I get that correct?
Absolutely.
Or you can call 870-414-5158 if you'd like a paper copy. Some people don't get into the computer too much, and that's okay.
You can go to the Facebook page of the hospital and click on the link there, or our website, narmc.com, and we also have a link there as well.
Lots of ways. Thank you so much, Vince, for coming in again. And Marcia, it's always a pleasure to be a part of North Arkansas Regional Medical Center's program. We've supported you, and you've supported us for many, many years, and we want to continue that. Good luck with the deal.
Thank you.
Thank you.
Stay with us here on Connection. We'll be back in a moment and talk to a couple of people from FedEx Freight about a driving safety program on Connection.
No one does a better job at keeping your wheels rolling like Joe Honeycutt and the staff at Tire World in Harrison. Tire World not only offers the best brands and tires such as Michelin and BF Goodrich, they also have a complete service department. From wheel alignments and brakes to shocks and struts, Tire World will keep you on the road safely. From large commercial tires to lawn tractors, Tire World will keep you rolling. Plus, Tire World features a large selection of rims and wheels in stock for almost every make and model car, truck, or SUV, with special orders available. With quality you can count on, stop in to Tire World in Harrison. When the day-to-day routine has drained the color right out of you, let Extreme Tanning help you get back your healthy radiance. With state-of-the-art 10 and 20-minute tanning vents, a stand-up booth, and UV-free spray tanning, Extreme Tanning can help you get that golden glow you've always wanted. Also, check out their complete line of tanning accelerators, moisturizers, and accessories. With membership programs starting as low as $14.99 per month, this staff at Extreme Tanning will assist you in selecting just the right plan. Take your tan to the extreme. Extreme Tanning, Highway 43 East in Harrison.
Back on Connection here on TKO8 Television. Dennis King, my co-host, Tabitha Odegaard, again, could not be with us today because of family medical issues over in Mountain Home. We hope her father gets okay there. Anyway, we've got the second half of the program today to talk about something a little different than our first half of the show. It has to do with a big thing going on, and it's sponsored by FedEx Freight. Glad to have you two in. We got Jessica Kibling and Mark Coder. Is that correct?
That's correct.
Good, very good to have you in. You got your official FedEx color on. What happened to you today?
Red and purple. Those are our colors.
Those are your colors. Okay. Yeah. Very good. So what is this event? Let's talk a little bit about the event, and we'll kind of go back and forth here.
This is a community safe driving rally.
Okay.
Our focus is to raise awareness to safe driving on our streets and highways around not only our area here, but around the nation.
Okay. So why are you doing it? Who came up with this? Is this a national program, or is this just something that you guys came up with?
This is something we came up with a couple of years ago. Okay. This is our third annual event. It's grown some since our first one, but we thought that we have resources in America's road team captains who work for us and are ambassadors to our industry. They spend time all over the United States talking about the message of safety and driving around large commercial vehicles, and it just seemed like that we need to be doing that right here in our area,
right,
and use those resources. And so we thought that'd be a good idea to reach out to the community, reach out with our sister companies and Commercial Vehicle Safety Alliance, and try to raise awareness here.
Well, I realize that FedEx is a huge corporation, one of the largest in the nation, and you do have a lot of vehicles out there on the roads all the time. And I know safety is a very important part of your business, not only from a safety standpoint of lives and injury and so forth, but from your assets base, your trucks. So it is important that your team out there, that they are constantly aware of the needs for safe driving out there. And some people, it's amazing. There's so many big trucks on the highway. How many of you out there in the viewing audience have been going down the interstate highway, and these big trucks, they can't react quite as fast as you can with a small vehicle, but they do a pretty good job of taking care of themselves out there when you've got some questionable drivers out there, whether it be motorcycles or smaller automobiles or whatever, and these big rigs are out there rolling up down the road at the same speed as most other vehicles out there. So it's a very important part of the thing.
It's extremely important.
Yeah.
And a large part of our message here is on distracted driving. Those are the things that we all see. We all see at every intersection. Going home tonight, look around and see where people's eyes are as they're sitting waiting on the line. They're doing lots of things rather than concentrating on driving. So part of what we're here to do is raise awareness on distracted driving, texting and cell phone usage primarily.
Yeah, that's gotten to be a real big problem, hasn't it?
It's a huge
across
problem.
the nation. In a lot of states, have passed laws, I guess, already where you can't text and drive, and some going with the cell phones. You got to have a hands-free operation on your cell phones and stuff. But
Arkansas is one of those
in
states.
Arkansas is one of many states. I know a lot of them still haven't passed it, but more and more going into that situation, which I think is a smart move. I mean, if you've ever been out there on the highway and you're driving down and all of a sudden you see somebody texting and all of a sudden they're over on the curb or over coming direct in your direction, you know, it's a scary thing.
Yes.
And lots of, and not just young people, but a lot of young people are, you know, getting into the texting and cell phone. Everybody's got a cell phone anymore. But the national safety standards have had to kind of take hold of this thing and try to get a handle on it.
Yeah, it's a big focus with the Department of Transportation. The Administrator Ray LaHood, this is one of his passions, and that ties in with our event.
Okay.
Operation Safe Driver is sponsored by Commercial Vehicle Safety Alliance, which FedEx is a major player in.
Sure.
CVSA is it's industry and enforcement working together for the safety of everybody. Okay. So it's the truckers and the officers working hand in hand to raise awareness for safer roads. As part of that, Operation Safe Driver came to be, and that's a national awareness campaign that CVSA sponsors, and as I said before, we're a big part of. We'll have signs and banners that students, not just students, but all attendees, will be asked to sign a pledge and sign these banners so we can give those to Ray LaHood here next spring at an Operation Safe Driver event. So we hope to get a lot of signatures, but more importantly, the commitment that goes with those signatures. That when somebody signs their name saying that I'm going to be more aware of how I drive, that I will put my phone on mute, I will not text. Maybe this will help solidify that commitment.
So this is a fairly, you know, it's like Tuesday through Friday, I guess.
Tuesday through Thursday morning.
Tuesday through Thursday. Mm-hmm. So what are you having area schools come in for this? Have you made arrangements with area schools to have their students brought in, or how's that work?
Yes, we have schools from Mountain Home to Marshall, Hollister, a lot of the smaller schools, Bruno Payette, sure. Some of those schools that don't have driver's ed programs. They'll schedule to bring their students that are either driving age or about to be. Okay. They'll be scheduled, and we've got those so they arrive and we can process them and run them through different workshops and timely, okay. And using our road team captains. And so we have right over 1,000 that we have confirmed. Wow. And that's not counting the Homeschool Association. I think we had about 6 more schools that we still have to poll and get their appointment times. So we'll have well over 1,000 students, and hopefully their parents and their siblings. This right. Isn't just for school age. It's for everybody. We can all learn something.
Yeah, for sure.
Yeah, it's open to the community. We'd love to have anybody come down because, I mean, it's never too late to learn those good, safe driving habits.
Is this totally sponsored by FedEx? Do you have other sponsors, or is it
at this
FedEx?
Point it's solely sponsored by FedEx, and now the Arkansas Highway Police, they will help us.
They're going to be out there.
And of course the American Trucking Association's America's Road Team will too. But as far as the lead, it's a FedEx CVSA event.
You mentioned your drivers. I guess your top safety driver. What do you call them? Your
America's Road Team.
America's Road Team. Now, do these people, do they go around in different places around the country and do this type of thing, make presentations and talk about road safety and stuff? Is that something they do on the side? Of obviously they're a part of your team full time, but
yeah, they work for us. But part of our obligation to the American Trucking Association and to America's Road Team is that we make them whole as far as any wages they may have missed by not working. Okay. They take care of all of the logistics of getting them to different events. They'll talk from anything from events like this. They'll go to Capitol Hill in Washington. Some have spoken in front of Senate hearings. So these aren't your stereotypical truck drivers. They're ultimate professionals. and that's what we want people to
see. Advocates for safety all over the place. They even go and they talk to other drivers as well too, because it's important for them to be informed on both sides, whether they're a commercial truck driver, professional, or just your average driver. We all need to learn how to share the road safely.
So are these individuals actually, they have had driving experience?
They're professional drivers, most of them millions, multiple millions of miles, safe driving.
Right. And then also obviously have their expertise of getting the word across to other people, you know, and speaking and talking about.
Yeah, one of the drivers that will be here is Don Logan, and Don Logan is the national grand champion driver for 2012 at the National Truck Driving Championships. He's the best of the best in the United States. Most of all, he's just a very personable person that cares very deeply about safety.
I mean, I realize there's a lot of big companies that have over-the-road drivers and so forth. Do you find that smaller companies do they participate as much in the safety programs as the big companies, or is that still an issue out there?
In Arkansas, I can speak to that. We have all sizes that are very much involved in the Arkansas Trucking Association Safety Management Council. Obviously, there's all sizes, and there's varying levels of commitment. But I think everybody realizes that it's good business. Safety is good business.
Yeah. There's so many small trucking companies or even individuals that just have a truck, you know, out there that may be running up and down the road. And I didn't know if it's something that you maybe see less participation in the mom and pop operation that's maybe got one or two trucks. Maybe they don't get as involved, and maybe there's still issues with maybe those type of organizations or companies that don't get as involved as a FedEx or a JB Hunt or a UPS or some of the ones that's got thousands of truckers out there.
Well, that's why CVSA exists. It's about education with the law enforcement, and their focus is education to all drivers, commercial drivers. So obviously there's the enforcement enforcement arm, and that's part of what they do. But more importantly, their focus is consistency in inspections and in helping companies of all sizes to be safer.
Very good.
I think, you know, drivers are people just like everybody else. They have a family at home, and no matter what size company they work for, they want to get home safely to their families.
Absolutely.
So, I mean, it is a priority for everybody, no matter what size company you work for.
Right. And obviously, you know, they have to make a living, and injuries or damage to their vehicles cost them a lot of money if something happens like that. Real quick, we got a minute left. Let's go one more time. The dates and where and when.
It'll be next Tuesday, Wednesday, and Thursday at the Cash Center at the Harrison High School. Pull in the parking lot there as if you were going to a football game, and you'll see us right there.
Okay. They come in, and you'll register, I guess, as they come in.
Yes, we'll have a reception tent, and that's where we'll pair them up with other students. But again, it's open to everybody.
Very good.
Regardless we can get out.
Very good.
We've actually invited the truck driving school here at the college and some others too to bring their students.
Very good. Well, we appreciate it very much. Jessica Kibling and Mark Corder, we appreciate you coming from FedEx Freight here and talking to us today. Excellent program, and don't forget the dates, October the 16th through the 18th. It'll be up at the Harrison High School right by the new F.S. Garrison football stadium. You won't be able to miss them. They have a lot of big trucks there and a lot of hoopla going on. But go by, regardless of age, if you have a student in your family, you really should have them go up there and be a part of it. Thank you both for coming in. We appreciate it, and good luck with your event coming up.
Okay, thank you, Dennis.
Thanks for joining us on Connection today. We hope you enjoyed the show. Join us each week at this same time as we continue to go out and bring you what's going on around the broadcast area and local news, weather, and sports right here on your local broadcast station.